Hi all. Um, so communication plays a pivotal role in addressing social determinants of health, SDOH, which from the reading we know as the economic and social conditions that influence an individual's health. These determinants include factors such as income, education, housing, and access to healthcare, among many, many, many other things as we read. Effective communication is essential in raising awareness about SDOH, advocating for policy changes, and ultimately improving health outcomes for marginalized communities. Effective communication can help raise awareness about the impact of SDOH on health disparities. It can educate the public about the root causes of health inequalities and the importance of addressing these determinants. Communication is a powerful tool for advocacy and influencing policymakers. It can be used to mobilize support for policies that aim to reduce disparities in healthcare access, income, education, and housing. Clear and culturally sensitive communication is essential for educating individuals from marginalized community about healthy behaviors and accessing healthcare services. Addressing SDOH often involves dealing with issues related to stigma and discrimination. Effective communication can challenge stereotype and biases, reducing the stigma associated with certain health conditions and social backgrounds. We read a lot about that in most of our pieces this week. Communication can empower individuals to become advocates for their own health. Informed and engaged patients are more likely to seek care they need and make healthier choices. So what can we do, or what can each of the different things do to help with this SDOH? Individuals can educate themselves, so individuals about SDOH and how they may be affected by these determinants. They should advocate for their own health and access to necessary services, participate in community organizations and initiatives that address SDOH, support and encourage dialogue within their own community to create awareness and promote change. Be aware of cultural differences and the unique needs of marginalized communities. So this will help in communicating effectively with individuals from diverse backgrounds because we're not all the same people. Healthcare providers should receive training in cultural competency to better understand and address the needs of diverse patient populations. A lot of the time when you go into a doctor's office, they'll use just crazy language that you have no idea. But to combat that, they can use a better language, a more, I don't want to say dumbed down, but something that's maybe a little more useful for the patient themselves. But basically provide or avoid the medical jargon and possibly just provide written materials with any different languages to ensure patients from different backgrounds can understand their health information. We talked a lot about that last week. Access, they could improve and provide access to patients' health literacy and give resources and support to help them make informed decisions about their own health, create and support legislation. So this is policymakers. So policymakers can create and support legislation that addresses SDOH, such as policies to increase minimum wage, expand access to education, and improve affordable housing options. It kind of all starts with those things. And I don't know about where you're from or your area, but I live in the St. Louis area, and these are things that we talk about frequently. I live on the Illinois side where minimum wage is growing to $15, while on the Missouri side, it's still national average of around $8 or $9, and that makes a huge difference. Policymakers can involve community representatives and leaders in the process to ensure that proposed solutions are responsive to the unique needs of marginalized populations. Invest in data collection and analysis to better understand how SDOH impact health outcomes. and it can just be more informed when creating policies for their communities. Targeted messages is crucial in addressing health disparities as it tailors communication to specific communities and their unique challenges. It can involve using culturally appropriate language, visuals, and channels to reach marginalized populations. This helps in targeted messages. They resonate more with the intended audience as they directly address the issues and barriers that those audiences face. By understanding the specific challenges faced by a community, tailored messages can provide solutions and resources that are more effective in overcoming those barriers. Customized messaging can build trust with communities that have historically been underserved or mistreated by healthcare systems. And again, living in the St. Louis area, I hear a lot about that in a lot of the communities in St. Louis. Communication is a critical tool in addressing social determinants of health to promote equity in healthcare communication and provide health outcomes for marginalized communities. Individuals, healthcare providers, and policymakers must work collaboratively, employing strategies like cultural competence, clear communication, and targeted messaging. By fostering understanding and addressing the root causes of health disparities, we can move closer to achieving health equity for everyone involved. And everyone that needs something. So many of our readings this week focused on cancer, but also people of color and those that may not have the loudest voices, such as seniors and other marginalized groups and communities. That being said, I asked these questions for discussion. Firstly, in what ways can targeted messaging and communication strategies be used to address unique challenges faced by specific marginalized communities in the context of healthcare and social determinants of health? So specifically in areas that you may know or that you may have heard of. And then the other question I ask is, what are the ethical considerations in healthcare communication when addressing social determinants of health, particularly in relation to cultural sensitivity and empowerment and reducing stigma? So I'm looking at the cultural picture. We are a melting pot of a class, and I'd like to hear your opinions on those things. Thanks so much.